Spina bifida is one of the diseases in a group of diseases called neurotube defects. It is the most common neurotube defect that we have. This means that during development, the child's spinal cord doesn't close normally. So there's a defect in the closure of the spinal cord, and often we have contents of the spine and the cerebrospinal fluids, the brain and spine water, come out in the form of a sac at the back of the back. Spina bifida is a very common condition here in Zambia. Not only in Zambia, it's a very common condition worldwide. Every year, there are about 300,000 children born with spina bifida. In Zambia, we have 2 per 1,000 live births of cases associated with spina bifida. And this means that every day, 2 to 3 patients are born with spina bifida here in Zambia. Most of the cases of spina bifida come about because of a deficiency in folic acid at the time of conception. Other causes of spina bifida, apart from the deficiency of folic acid, is women that have seizures. So women that have seizures should also be on folic acid, because some seizures compete or reduce the amount of folate in the body, some seizure medications. Women should avoid overconsumption of alcohol, and women should strive to have a balanced diet and live healthy lives so that they have healthy children when they're born. Spina bifida is a terrible condition because where the spine is deformed, where there is a failure of the closure of the spinal cord, at that level you will have spinal cord damage, and most of these children will have deficiencies below the level of the lesion. It means wherever it happens, anything below that level will be paralyzed. Children that have spina bifida that are not operated early risk having their lesions colonized by bacteria, and that can cause meningitis. So these children are at a risk of death if they're not referred on time. A lot of the patients that we receive with spina bifida come 2 weeks or more after birth. Some of them do not know that they could get the service here at UTH. Some of them got lost in our referral system. Maybe they were kept longer at their health facilities, the referring institutions. This could be because of the fact that maybe they might have been treated for another condition like meningitis or pneumonia or neonatal sepsis, and then after discharge, that's when they managed to come to us. Others just did not know that they could get help. So, we have patients coming to us at 9 months, 1 year, 2 years with the spina bifida lesion. There are other forms of spina bifida that you do not manage surgically, but they're very rare. The ones that you manage surgically are called spina bifida cystica. This is where the cyst or the myelomeningocele cyst with the spinal cord is outside, and you have to push everything back. So there's no medication that can do that. This is a purely surgical condition where you take the child to theater. You put them under general anesthesia, so they lie on their belly, and the back is exposed to us. So we clean and drape the child and refashion that lesion. So we make an incision, and we identify the spinal cord, and we put the spinal cord where it's supposed to be and close it up with the normal tissue that is supposed to cover a spinal cord. And then the skin lesion, we refashion it and do some plastic surgery on it. The surgery is cosmetic, so that we close that defect in the spinal cord, and also the surgery is meant to prevent further damage to the spinal cord, and also prevent infection. Closing that defect prevents illnesses such as meningitis or local infection of the lesion. That does not mean that we are repairing the spinal cord. We are just closing that defect, repairing it so that they can be nursed by their mothers properly, so that they avoid getting infections. And thereafter, they can, develop as normally as they can. Unfortunately, the spinal cord is damaged permanently. For the prevention of neural tube defects, a mother is supposed to take folic acid, to start taking folic acid 3 months before conception. That is 3 months before the sperm meets the egg. Unfortunately, most of the pregnancies are unplanned, and women miss that opportunity to start taking the folic acid because they have not been planning for pregnancy. This means that we need to find another way to ensure that our women of childbearing age have adequate folic acid in their bodies at the time of conception. Folic acid has been shown to prevent about 70% of all neurotube defects. There are a lot of myths, unfortunately, that surround the intake of folic acid. Folic acid causes miscarriages. Folic acid is bad. It causes anemia. It causes all these things. Those misconceptions are real, and they prevent women from taking folic acid. And I think it's upon us as healthcare workers to do our best to raise awareness for the benefits of folic acid, especially in the prevention of neurotube defects. Every woman deserves to have a healthy child. Every family deserves to have a healthy child. And we can ensure the birth of healthy children by adhering to good health practices, taking folic acid or having enough folic acid during the time that we plan to have children, and also having good health-seeking behavior. Have antenatal scans when you're pregnant, have the breast anomaly scan so that you know what type of child you're expecting, so that you know what kind of delivery or birth plan you should have. And even after the child is born, it is always good to continue to seek expert opinion on children that are born with birth defects, so that they can be referred early for specialist management.